is Dr. Benzinger on health with secondopinion.org with another educational session. Today we have picked B1 thiamine as our educational session. Why B1? One of the key components in our nutritional regime or armament that helps keep us well on a consistent basis. The most important thing is for you to understand exactly what a vitamin is, what its purpose is, and its uses and values, as well as what burns it out and why we need it. B1, if we do anything first, we want to talk about the natural form associated with B1 thiamine. The natural form comes in a form called thiamine pyrophosphate. Thiamine pyrophosphate. This form is used in the body exactly the way it is on a cellular level. The synthetic forms, these are most commonly added and subtracted some element of the pyrophosphine to become thiamine mononitrate and thiamine hydrochloride. Those are the forms that the synthetic forms are in, okay? Now, I've talked to many researchers associated with this, and they say that, well, when we use the synthetic forms, it still shoves the amount of B1 in the bloodstream up to normal. The problem with it is the body then needs to take it, convert it, add extra elements to make it thiamine pyrophosphate, which is the natural form that your cells use it, or on a cellular level. So we need to understand that the bottom line is if we can get it in a natural form with a reasonable cost, that's the form we want you to take it in, because your body's going to use it more easily, more consistently. It's going to be better for you. Whenever I do one of the educational sessions on vitamins, I always like people to look at this chart. The reason for this chart is it gives you an idea of synthetic versus natural. If you look on the left-hand side of your screen, look at ascorbic acid, okay, and below it natural vitamin C. Natural vitamin C has multiple other factors beyond ascorbic acid, such as hesperin, rutin, bioflavonoids, J factors, P factors, K factors to some extent also, as well as certain proteins, carbohydrates, and fats. That's natural vitamin C. It makes sense when you look at the color scheme and how bright this is, as well as you can tell it's just filled with more stuff, that probably that stuff might make a significant difference in well-being. The same thing with B1 or thiamine. The likelihood of giving it to you in the most natural form gives us a higher success ratio as to it probably getting in your body and helping you get better. And here's the whole point. It'd be different if we're so healthy, we're just adding a little bit to make a difference. But many of you are fatigued, tired, grumpy, irritable, struggling with disease states or precursors to disease states. But the first thing is just pain and fatigue is constant in this society. The amount of recurrent ear infections or sinus infections, etc., etc. There has to be elements missing because it's not common to have the amount of illness that we're having in this country today. Frankly, just to understand a vitamin, I always like to make sure that you understand why it's a vitamin, what a vitamin is. And a vitamin is an organic substance that is vital for life. Majority of vitamins cannot be synthesized in the body. Thus, the diet or supplementation must be applied or supplied to make sure you get the needed vitamin. Fat-soluble vitamins, which is not this case, but I always like to mention it, fat-soluble vitamins such as D, E, those have to have, and vitamin A, have to have some fat in the diet. So those that have very, very low fat diets, I know it's getting confusing sometimes when we go through all this, but our goal is to try to help you realize that taking a little fat with those type vitamins actually helps their absorption. Water-soluble vitamins need certain things called synergistic vitamins. We're going to cover what those are. And we will look at that synthetic natural form issue. Most forms of vitamins are processed out of natural forms, okay? They almost always come from a natural form in the beginning. The question is, why would you go through all that processing? To get it out, it's kind of like getting out the diamond in the whole form. How much work and effort do we put in to get it out in the perfect form instead of cutting it up and more easily extracting it? I think that's what happens with synthetic versus natural. Or is it easier just to add some chemicals together? It makes it look just like the other vitamin in a laboratory, sell it to you and say, well, gee, it's the exact same molecular structure, so thus it must work the same. That is never the case, and it's very frequently not the case. It is very important to take this nutrient with other synergistic nutrients that make it work the best. And without the synergistic nutrients included in your body, you'll find that using synthetic vitamins, you'll burn out those reserves and mimic a deficiency in B1 that really isn't present, but it's simply because you're taking it in a highly synthetic form. Here's my point. It is not infrequent for me to hear that, oh yeah, I used to take that B6 or that B1 and 2 for my tennis elbow, and it helped for about 2-3 months, and then it just didn't seem to help. Well, guess why? They're using the highly synthetic forms more than likely, okay? Because when we gave it to them in a natural form, a more organic form, we found that it seemed to work and continued to work and seemed to correct the rest of their problem. And that has happened frequently, not just a time or two. So keep that in mind, okay? All right, when we look at the synergists for B1, there's quite a few. Magnesium, manganese, riboflavin, which is B2, peroxidine, okay, that is B6, a niacinamide, which is B5, and pantothenic acid, which is B9, and other B-complex factors. The point of it is, I like to see B vitamins taken all at the same time, and within this case, with some magnesium and manganese if you're going to get the highest absorption. Okay, so another point of view of this is if you'll look at this picture of all the things listed that makes up broccoli. Okay, it's a good one to look at because if you see it just goes on and on and on, and most of the elements that keep you healthy that you want to see in a multiple vitamin is in broccoli. Let's go on. Look at an apple. An apple a day keeps the doctor away possibly is not such a bad theory. And the reason why it's probably not such a bad theory is because look at all the exorbitant substances that are inside this apple. The bottom line is if I tried to make you an apple and put it into a pill form, you'd literally be taking bottles a day of vitamins just to be able to make up what comes in a whole apple. When you peel off that skin and just wash it up and clean it up, you really lose a lot of your nutrient values. And we've got some kids, in fact, over 70% of our population in kids have less than 1 serving per day of organic, natural, unprocessed fruit each day. And look at all the elements they're missing. Do we wonder why our kids have recurrent ear infections very early on and deal with asthma and all kinds of other disease processes as well as allergies on a consistent basis? Possibly because they're not eating the foods that would supply the nutrients to keep them well. Okay? What does this nutrient do in the body? Energy metabolism. It handles and really helps control carbohydrate metabolism. Remember, carbs make you fat, not fat make you fat. Keep that in mind. If you haven't picked up our Secrets to Vital Health, you should pick it up because that will explain why you need supplementation in certain cases, how much supplementation you might have to consider, and based upon the way that we produce our foods today as to why that's a big issue. And when we look at this nutrient and carbohydrate metabolism and diabetes and obesity and overweight situations, maybe this is a contributing factor. B1, lack of B1 in the body itself. It also affects your neurologic activity, brain and heart function, canker sores around the mouth. When you open and they crack and they hurt so badly, canker sores. And also you want to have B1, B2, and B6 in those cases. Fibromyalgia, sore muscles, and also just some swelling in the feet at the end of the day. If you don't have a heart or a kidney problem, B1 sometimes can be that issue, and pregnancy support. The deficiencies can produce these type of symptoms. Is it the only thing that could be involved? The answer is no. Could it be a possible factor? The answer is yes, and it cannot be ignored. Fatigue, anorexia, weight loss, irritability, emotional overlays, GI tract disorders, decreased acid to the stomach, fluid retention just throughout the body. You know, you always seem to hold that extra fluid. Weakness, heart abnormalities, stunted growth, convulsions, poor memory, polyneuritis, calf muscle tenderness, confusion, and just uneasy, anxious irritability. Okay? When we look at the food sources with this, pork, beef, liver. So you vegetarians, pay attention to the next part because you've got to keep these in your diet to have a chance. Brewer's yeast, whole grains, brown rice, legumes, and beans. I say whole grains in the way that I do because so many of the grains that are produced in this society are very poorly put together and are synthesized in some cases and broken down, and you don't end up with all the nutrients necessary to keep you, the vegetarian or pseudo-vegetarian, in shape. Risk groups, those eating poor quality diets, B1 deficiencies, common malabsorption conditions, so elderly from 60 years old up, you can almost be guaranteed are going to struggle hard. You got to fight hard to keep this nutrient in your body, as well as all the B vitamins, and alcoholics. Okay? Toxic symptoms, so here's one that it's almost an impossibility. Could it be done? I'm sure, but you would probably have to worry about trying to get in the Guinness Book of Records, because you're going to have to work really hard to get too much B1 into your body. When we look at medication interactions, the tricyclic antidepressants seem to shove or push or chase B1 out of the body a bit. Oral contraceptives, we know that those things, the pill, to stop you from getting pregnant, or in some cases to regulate your periods, quote unquote. There's a lot of other things that can be done. Check with Dr. Carolyn Dean .com, and you'll find that she has lots of other comments beyond oral contraceptives for irregular periods that might be a consideration. Diuretics, antibiotic medications, antiviral, antifungal, and that's a small list. It goes on, but we can't cover it all. You'll probably have to get a book on that. If you go to secondopinion.org, on that site, you'll see some of the books that we list that we would want you to possibly pick up and be able to see what interactions that you'll have with the medications you've got. The truth is, your pharmacist and your doctor have done little, if any, work in this area to be able to mention to you, gee, if you're taking oral contraceptives, you need this vitamin, this vitamin, this vitamin, because we know that it chases it out of the body on a consistent basis. Here's a recommended RDA dose. Again, Secrets of Vital Health. Make sure that you've seen that. You understand why the RDAs, in my estimation, in some cases, in many cases, is very low. And it's 1 to 1.5 milligrams per day, very small amount, okay? When we look at Dr. Benzinger's advanced information about B1 thiamine, carbohydrate metabolism hits the top of the list because of obesity, overweight, and many things. We got people that are dieting, and here's the problem. With all the dieting that they're doing, they're causing B1 deficiencies, which causes carbohydrate metabolism problems, which means, guess what? We end up with more and more problems with the same thing they're trying to get off their body, which is fat retention. Thiamine is a key component for the body to break down carbohydrates and the use of them efficiently. Without thiamine, the tendency for carbs to be mishandled and cause blood sugar conditions that have been noted in the past, turning into increased or decreased fat loss, is important. When we mentioned earlier ankle swelling at night may be a thiamine issue. So at night, not all the time. Remember, we want you making sure heart and kidneys are in decent shape at those cases, okay? Muscles. Thiamine is very helpful in maintaining the coordination of your muscles. Thiamine seems to help some people with fibromyalgia symptoms and muscle tone being maintained. Thiamine helps in those areas. In severe cases, nervousness, cardiovascular, or heart system conditions may become involved, including depression, mental confusion, muscular weakness, anorexia, weight loss, peripheral paralysis, which is sometimes numbness or tingling in the feet and hands, and heart failure. In marginal cases, vague symptoms of anxiety, hysteria, nausea, depression, and loss of appetite can occur. So keep those in mind, okay? So here's the possible positive effects of making sure that you have enough B1 in your body. The carbohydrate metabolism may improve. Your nervous system symptoms may improve, quiet, calm down a little bit, preventing some of the cardiovascular conditions in the future. And muscle weakness and soreness may improve also. We hope you've enjoyed today on B1 thiamine, that this might educate, help you, and encourage you to making positive choices for something conservative, something you can control, something that can make a difference for you. We hope you've enjoyed today. This is Dr. Benzinger on Health with secondopinion.org, and may God bless you.